how to get off high blood pressure medications safely. Number 4, master stress management. Yes, we always talk about stress and how stress is bad for your health. Well, listen, it's real and there's science behind it. When you are stressed, you release stress hormones like cortisol. Cortisol can increase your blood pressure by causing your heart to beat faster and by causing your blood vessels to tighten. And so imagine if you're someone who gets road rage, or if you really get triggered and angry, or if the cashier at the grocery store, if they have an attitude that upsets you and you're stressed out, well, then that can cause a cortisol spike. It can cause an increase in your blood pressure. Let's take it a step farther. If you are a person who is chronically stressed, if just kind of things that are going on in your life, work issues, family issues, money issues, if these things have you in a chronic state of stress, then that could lead to you having chronic high blood pressure, and that could be why you are on so many high blood pressure medications. So yes, being masterful at reducing your stress is a great way to get off of high blood pressure medications safely. Here are some tips. 1, you want to organize your day. Make sure you give yourself a things to do list and prioritize the top 4 things on that list. You're not going to get everything done. And so make sure you prioritize things you want done for that day and give each thing a deadline. Even if it's a long-term goal, put a deadline on it, because things that don't have deadline oftentimes don't get done. Also, especially if you're a person who gets road rage, plan to leave your house early, 15 minutes earlier than you need to, 30 minutes earlier than you need to. This way, you'll be less stressed about getting to where you need to go, finding the meeting place, and that can help reduce your cortisol, which can reduce your blood pressure, which can help to get you off some of these medications. Another great thing, mindfulness techniques, okay? Learning how to meditate. And guess what? You can download one of these free apps on how to meditate. Doing exercises like yoga and Tai Chi can reduce stress. Also, just taking a brisk, peaceful walk in a quiet neighborhood or in a quiet place. And if you really have a high level of stress that you're having difficulty managing, even some form of anxiety, make sure you consult with your doctor and or a mental health professional. If you are able to successfully reduce your stress, then yes, that's one more key to being able to come off of blood pressure medications. To learn some of these yoga and Tai Chi moves and some slow, deep breathing and even progressive muscle relaxation, all things that can help you to manage stress, be sure to check out my video on the top 10 exercises to lower blood pressure the natural way after you finish watching this video. Number 5, the top diets for lowering blood pressure. Yes, what you put in your mouth matters. And so it's important to get on a diet or a lifestyle of eating that's going to help you to keep your blood pressure low and to reduce some of the medications that you're on. The DASH diet, dietary approaches to stopping hypertension. This diet is excellent for lowering blood pressure. It's not just a fad. It's not one of these fad diets. It's actually scientifically proven to help to reduce blood pressure. In the DASH diet, it's actually rather simple. The concept is, anyway, you focus on filling your plate with fruits and vegetables. You fill your plate mostly with these items, and then you have a portion of some lean proteins. If you eat meat, then those lean proteins would be things like fish or chicken, preferably white meat with no skin. And you definitely want to have a low amount of sodium in your everyday diet. Another great diet is the Mediterranean diet, which is full of healthy fats like olive oil. Make sure you consult with your doctor and your registered dietitian to find out which diet is best for you. And I guarantee if you're able to incorporate these healthy diets, then that is a great way to get off of high blood pressure medications. Food is medicine. I have a lot of patients who come in to see me, and on our first meeting, they'll say, "Doc, I don't want to be on any blood pressure medicines. Or I really can't stand blood pressure medications." Listen, I'm a doctor. I understand. And even as a patient, I don't love medications. But the truth of the matter is that sometimes medications are necessary. Case in point, if you walk into my office and your blood pressure is 180 over 110, you have a headache and you're like, "I don't like being on medicine." Guess what? I'm going to recommend that you get on medications to get out of that stroke level hypertension. And then I'll also give you all of these tips on how to get off of blood pressure medicines. And as your blood pressure lowers, then we will wean you off of the medications. Some people don't like medications because they can have side effects. And yes, they absolutely can. Some can cause your feet and your ankles to swell. They can cause you to have a decreased libido. They can affect your love life. They can do all kinds of things. It's true. But do you know what else has side effects? High blood pressure. High blood pressure has the fatal side effects of causing heart attacks, strokes, and kidney failures, okay? And so we're always managing the pros and the cons. It is the most important thing to have your blood pressure under control, and so you can have a long, good quality life. So remember, this video is to serve as an inspiration and as a starting point for your conversation with your doctor. Again, please do not stop your medications or change your blood pressure medications without consulting your physician first. Also, remember to be patient with yourself. You're not going to walk in, implement tips, and then poof, automatically have perfect blood pressure. No, Rome was not built in a day, and neither was your high blood pressure. And so you have to have patience with yourself and patience with the process. Trust the process of lifestyle changes. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about.